Okay, we're scanning the room for you to finish the rest of the skills. We're going to do unclogging and removal. Okay, so here we go. So after you have placed the tube, the NG tube, say you come back in a little while and you notice that the patient's abdomen is very hard and distended. So you want to check to make sure that the NG tube is not clogged. So you're going to insert air. You would unhook the suction tubing and once again insert 5 to 10 cc's of air with a clean syringe. And you're going to do this while listening to the fundus part of the abdomen. And you notice that you can't get any air in, you can't aspirate anywhere else, so it is blocked. Okay. So now what we're going to need to do is unhook this, and then keeping this clamped, we are going to have a fresh syringe here, and we are going to get 30 cc's of water. If you get 30 cc's of just tap water, you would unclamp, and you would insert this again, and you hold one hand here and another hand on the plunger. You're going to go back and forth until the blockage lets go and you are able to whoosh, release all of the tap water through. And then you would hook it back up to suction, low intermittent suction. And then because you have hooked it up to suction again, you would need to, with a fresh clean syringe again, you would need to do the 5 to 10 cc's of air to get the tube away from the lining of the stomach. Okay, so then that is clear. Okay, so that is how we do that. So now let's say that the patient, the doctor has an order now for the patient to have the NG completely removed. So before you would remove an NG, you would want to do a total assessment of the GI. So you would want to make sure that you were hearing bowel sounds in all 4 quadrants, and you are. And you would want to aspirate the air. You want to aspirate some stomach fluid so that you are able, just 5 to 10 cc's, so you are able to check the pH. And we did the pH in the last video. Bring it over to the strip, put a little sample on the strip. If the pH level is 4 or less, then you are in the right area. So because we're in the right area, we have already turned off the suction and we have checked, so we have made sure that the tube is functioning properly and it is in the right location in the patient's stomach. So now what we would need is we need 20 cc's of water and 20 cc's of air. So we need 20 cc's of water and then 20 of air. And then holding the tubing, you would keep the tubing clamped after you had the suction off. You would keep the tubing clamped continually until you were working with the tubing to avoid any excess spillage coming out of the tubing. So we've got 20 of water and 20 of air, and we hold this in an upright position. And we would pull this in because there would be dark, biley stomach fluid in the tubing here. We would push in the 20 cc's of water, which would wash all the bile out into the stomach, and then the 20 cc's of air, which would wash the water out into the stomach. And then we're just going to leave that connected to avoid a mess. And then we would unhook all the secure hookings, the pin over here to the side, and the, I know I was talking there and I pulled it off too much, but, and the pressure here from the patient's nose, the tape. And we would ask the patient to take a deep breath, and then while you're pulling, you would pull a hand over hand over hand over hand over hand, pull it out, place it into, you would make sure that all this is intact as well, and place it all into the chuck. And that is all you would do, and then you'd write up your dark note, and that is how you remove an irrigated NG tube.